Each step in the process of phlebotomy affects the quality of the diagnostic blood specimen and then influence the test result, which make a difference to the clinical judgment. A safe, efficient, and standardized blood drawing practices can not only ensure a low risk of the clinical error and also avoid personal injuries. It summarizes as follows. Upon receipt of the request for blood collection, check all information on the request for completeness. Ensure that the blood specimen is drawn from the individual designated on the test request and labels. Perform hand hygiene immediately before patient contact. Ask the patient if he or she has problems with blood draws or other conditions or complications pertinent to blood specimen collection. Assist the patient in extending his or her arm into the proper position. The preferred venipuncture site is the antecubital fossa. However, veins on the back of the hand are also acceptable. Prioritize antecubital vein selection as follows. 1. Median and lateral extent of the median cubital veins. 2. Cephalic vein and the accessory cephalic vein. 3. Basilar vein and medial aspect of the median cubital vein. Appropriate supplies are selected including Improvacuter blood collection tube, Improsafe safety blood collection set, tourniquet, alcohol pad or clean gauze pad with 70% isopropyl alcohol solution, sterile gauze pad and other supplies. Inspect all supplies for possible defects and applicable expiration dates. Put new gloves on before the venipuncture is performed. Gloves must remain intact during the procedure. Apply the tourniquet 5 to 10 cm above the venipuncture site. Cleanse the site with friction using a clean gauze pad with 70% isopropyl alcohol solution or an alcohol pad. Allow the area to air dry. Take the safety blood collection set and remove its protective cover from venipuncture needle clockwise. If the lure adapter is not fixed, screw the lure adapter tightly. Ensure the patient's arm or other venipuncture site remains in a downward position to prevent backflow from the tube into the vein. Puncture the vein with a steady, forward motion in the direction of venous blood flow while keeping the needle in line with the vein at an angle of 30 degrees or less. Insert a needle into the stopper of tube vertically. All addicted tubes must be filled to their state volumes. When the tube is filled to its state volume, remove the tube from the needle and mix it gently. CLSI document GP41 collection of diagnostic venous blood specimen recommends the following order of draw when drawing multiple specimens for clinical laboratory testing during a single venipuncture. The order of draw is the same for specimens collected by syringe, tube holder, or evacuated blood collection tubes. When using a wind blood collection set for venipuncture and a coagulation tube is the first tube to be drawn. A discard tube should be drawn first. The discard tube must be used to fill the blood collection tubing dead space and to assure maintenance of the proper anticoagulant or blood ratio and need not be completely filled. The discard tube should be a non-addictive or a coagulation tube. Immediately after filling any tube that contains an additive, mix the blood gently and thoroughly according to following inversions. Release the tourniquet. Tourniquet application must not exceed 1 minute. If a tourniquet has been in place for longer than 1 minute before accessing the vein, it must be released and reapplied after 2 minutes before the venipuncture is performed. When collect blood for the last tube, remove the venipuncture needle from vein when there is still 0.5 ml draw volume left. Place a clean gauze pad lightly over the venipuncture site and apply pressure to the venipuncture site. Patients must apply direct pressure as long as the phlebotomist constantly monitors the site to ensure pressure is adequate. Pull the needle into the protective cover to activate the safety feature and dispose it into the sharp containers. After blood collection, the specimen should be handed and transported. Follow CLSI guidelines.